Hello, this is Dr. Leeds of drleeds.com, and I'm just taking a little break here to review my blog. Um, as you can see, the most recent post is from February 11th, The Psychology of Addiction, the Other Side of Medical Addiction Treatment. And there you can see I picked this photo, which I intended to look sort of like a therapist couch, the traditional couch that a psychiatrist or a psychologist might have their patient lay on. And let's just read a little bit. Okay, we have to click here to read more. And the internet connection is a bit slow, I think. Okay, here, we're actually in the blog post now. Psychology may be just what you need for success. About a week ago, I had the pleasure of speaking with a psychologist and addiction specialist who has decades of experience in the field of clinical, academic, and forensic psychology. We discussed various topics, including psychology-based treatment options. I was impressed by the many tools that a clinical psychologist has available to apply in practice. There is more to psychology than you think. Patients may imagine that when they go to a psychologist, they will be laying down on a couch, speaking about their mother and their childhood as the doctor quietly takes notes. In reality, it does not work exactly like that. The psychologist engages the patient and gets to the root of the problem. Then a plan of treatment is formulated and updated as the course of therapy progresses. You can get better with psychotherapy, particularly when it comes to addiction. An important part of your addiction treatment plan can include seeing a doctor of psychology. Your time will be well spent, and you will leave with a real and practical plan to make changes to your life. Your life will get better. When I start patients on medication-assisted treatment for opiate and opioid dependence and addiction, I do take time to speak with my patients about issues that surround their drug use. I listen, and I also formulate a set of recommendations to help promote a drug-free life. A step beyond talking to your medical doctor. While I believe that I am able to provide useful guidance to my patients, I do not have the years of training and experience in psychotherapy that comes with being a doctor of psychology, with a specialization in addiction treatment. This is why, in addition to prescribing medication, I refer my patients to a local clinical psychologist. Psychology should be practiced by a doctor of psychology. Sometimes a patient will suggest that they do not need to see a PhD for therapy. They ask if they can see a counselor or a therapist. It may be someone with a certificate in addiction counseling. Often these counselors are recovering from addiction themselves and find it rewarding to work in the field. The mind is a complex entity. It takes many hard years of study and practice for a doctor of psychology to reach a high level of expertise in the field. This cannot be replaced by a short-term certificate program. There is a place for non-professional support, but it should not be a substitute for true professional care. You deserve only the best. My thinking on the subject has evolved over time. I believe that my patients should seek out the best in healthcare. Addiction is a hard thing to beat. Using the best resources available will help to increase the odds. The gold standard in addiction psychotherapy is to see a doctor of clinical psychology who specializes in addiction treatment. Why accept anything but the best when it comes to your life and your future? And that's it. I think that was pretty well written. Sorry if I slowed down a bit. I was trying to proofread at the same time, but at least for now it looks like it's pretty well put together, and I think the point is made. It's important to go for therapy when you're getting medication-assisted treatment. If you're taking, for example, Suboxone, it's important that you go for therapy and get to the root of your problems of why you got onto drugs in the first place and how to avoid the triggers and develop your self-esteem. And there's a lot to it. I recommend making an appointment with a psychologist. You know, the group meetings are great and they can be very helpful to a lot of people, but that's not going to replace, you know, the benefits that you'll get from seeing a good psychologist. And that's the end of the video. Thank you for watching. If you have found this to be helpful, please subscribe to the channel and please like the video. I appreciate it. Thank you.